is a record for this group to get going. It's only 11:30. 9 or 34, which is good for y'all. We're usually way late, but I thank you everybody for coming. If you didn't get the message or the memo, the eyeglass cleaner cases are over there, one to a customer, and that's kind of our little special holiday giveaway. And be sure to enter for the door prizes. Dr. Dyer, I believe this is his third or fourth time back visiting us, and we very much appreciate him. He's an excellent speaker. And we also appreciate the pizza. Thank you very much for delivering that, having that delivered. He's chief of surgery at Skyline Medical Center, member of the medical staff with surgical privileges at Hendersonville Hospital as well. Serves as team physician for TSU, Beach, Hendersonville High Schools, the Ohio Valley Conference Tournament physician, and the women's NCAA Final Four head physician this year. So without further ado, we will let him take it away. Thank you, Dr. Dyer.
Sure, thanks. Get this up. Today, I think there are probably some familiar faces, and I was saying, eat your pizza. I'm not here to lecture about too many things. I have a talk that has mostly to do with workman's compensation, but what I figured was, and I shown a lot of pictures in the past and talk about surgery stuff and things like that, and I can certainly take questions about any of that. Part of the talk today is really a lot of people here, I mean everyone here is an employee of somebody, a lot of people are supervisors, and they're kind of injury and employee injury things that come up in a city, in a company, everywhere, and I just thought, and I may skip through some slides, but it will give us something to talk about, and it's just an idea that, I'll hit this, and it has this great word on here, comorbidities and workers' injuries. And I remember thinking, what is a comorbidity? And co means, it's together. And so if you have an injury and morbidity, it sounds horrible. I mean, firemen, they see things, there's mortality and morbidity. And mortality is when people are dying. Morbidity are things that make people less than perfect. And so we're going to have a whole category of those, but when we talk specifically about injuries, things add up. And again, the fire people have gravitated over here, but there are people that break legs, and then there are 500-pound people that break legs. And there are people that fall off a toilet, and then there are 350-pound people that fall off a toilet, and you can't get to them. And there are people, when we do surgery, what are some things that add to the degree of difficulty? Well, size is something that's come on in the last 25 years that you can't believe. But there are things like diabetes and high blood pressure, and they all add up. And then within the younger age groups, I mean, alcohol addiction, tobacco addiction, opiate addiction, all these things add up and make management of injuries a lot harder. And so as we sit in our offices and everyone and every family comes in touch with medical complications. Everyone knows someone who's diabetic, big or small. Everyone knows someone who smokes, big or small, old or young. Drug addiction is something that comes up. And so, like I said, I'm not here to lecture about that, but what we know is that it makes a big difference. So morbidity, again, is something that makes us, when a person has one or more medical or psychiatric conditions at the same time as an injury. And so I like to think of it as less than perfect. And I think we're all less than perfect. Some people are a little more less than others. That's the way we look at it. Which comorbidities affect our patients or our employees or those kind of things? And there are a bunch. So we kind of went through the list. High blood pressure. Any raise of hands in here? I don't want to get into personal medical things, but I see people in the office, and I'll get down to the drug addiction. We'll have hands raised here. But in the office, we just go through the list of medications that people are on right now, and people are on a tremendous amount of medicines. People are on, it's kind of the Elvis Presley. I mean, people are on medicines to wake up. People are on medicines to go to sleep. People are on medicines to lose weight, gain weight, all these things. But if we go through this list, hypertension, obesity, we've now gone to electronic medical records in our office. And the biggest question people get at our front desk is, how am I obese? Well, the computer figures out your weight and your height in something called body mass index, BMI, and obese is a medical term. We always have the front desk is good because I have these football players that are 6'1", 232, about 6% body fat, and they come across as obese because their BMI is 30.3 or something. And I've joked with my nurse here, Beverly, this is my nurse, and about, are you going to tell Thomas that he's obese? But we have, so it prints out in this electronic sheet, and it says you're obese. And what, if you look at insurance tables, what is overweight and what is normal? I always like to think I'm 6'2", but I'm probably close to 6'1". I weigh 160 pounds, and I'm what's considered normal. I'm like the skinniest guy I know in the whole world. And so you look at these insurance charts, and so the normal is 6'1", 160. 175 is considered heavy. 190 is getting towards this overweight category. And if you weigh 200 pounds and you're 6 feet tall, you fall in a category of a BMI of 30 that is now considered obese. So morbid obesity is considered 100 pounds greater than your ideal weight. And that's actually a BMI getting close to 40 or 50. And so 50 is someone that is about 5'4", 260 pounds. That's a BMI. So these things add up. And when we do orthopedic surgery, right now there's a real move that we're, really joint replacements should not be done on anyone over a BMI of 40 unless we're really sitting down and talking about potential complications. So if you throw in high blood pressure, obesity, diabetes, type 1 or type 2. Well, the question I ask in the office is, what is your hemoglobin A1C? And people that know about their diabetes, that seems to be a good screening question, know that their hemoglobin A1C is 6.8 or 7.2, and if they get over 9, they're kind of embarrassed and probably don't say anything. But that is a long-term judge of what your blood sugars run. So if we're going to operate on people, boy, we'd like to have their hemoglobin A1C around 7, because that means they're going to heal their wounds at a relatively normal rate. They're going to not have higher risks of infection. And all of these things get thrown out of the window when we talk about trauma and emergencies, but this is for elective things. Depression comes in all different flavors. There are a lot of great medications out on the market now. One of the big hot topics among, in the NCAA, when we sit on medical boards, is depression among athletes, all the stress in high school levels and college levels, and it is just unbelievable now that my youngest is now a senior in high school, but if you notice your kids, everybody's problem is now their problem. So it used to be, when I was a kid, you might get a phone call at home that was screened by your parents or something, but people didn't really call much. Every once in a while, the rich kids had the kids' phone at their house. But now, everyone that's hurt at Hendersonville High School, the entire school knows about it instantly. If there's a car wreck or a boat wreck or some tragedy, everybody knows about it instantly. And there have been a lot of articles about how does that lead to stress and depression and those kind of things. But there's a lot of mental issues among youngsters that I would say don't know how good they have it, but it's a big deal. Work area stress has all changed because we're at keyboards and we're not interacting as much, and it's just a tougher environment to work in these days. Chemical addiction goes right from tobacco. We can go right straight through to heroin. They're in any area where there are lots of people, there are lots of addictions. And you say tobacco and caffeine are not a big deal. People get heart palpitations from caffeine. People get anxiety built up because of different things that we could take just on a regular basis. But chemical addiction is another part that adds to problems when there are injuries. And then musculoskeletal disorders. There are probably a few people in this room that have arthritis in some joint that if you tripped and fell, might not be a big deal, but if you tripped and fell on your arthritic knee, it might be a much bigger deal because it triggers a whole chain reaction. Or you bump a shoulder that is just not quite right before, it doesn't mean you weren't functioning, but afterwards it kind of is the straw that breaks the camel's back. So there are a lot of these things, and these all fall into a list of comorbidities. Addictions, kind of went through that. Tobacco, narcotics, I left out alcohol. That's another one. Holiday time, be careful, please. The workers' part of this is that comorbidities, and the reason I'm relating it to a group of employees is that comorbidities reported have tripled in the last decade. So does that mean everyone is eating themselves to death with all these diet foods running around there? No, there's probably more of a way of reporting it, and it's all on computers now. And now when you go into a hospital, you may notice, or even in our office, everything prints out that you have a bunch of medical problems because you answered all the questions. And those are now all recorded that might not have been there. The claims cost are 2 times. So if a person is heavyweight and gets a back injury, the potential for a workman's compensation claim would cost an insurer twice as much when you throw in the extra things that go on. So does that mean that all healthy people, normal weight people, don't have any claims? No, it just means that things are additive and they add up in a big way. And so it's something that it's very important to address, and we're getting to that. What kinds of injuries do workers have? Well, workers have the same kind of injuries that everyone else has. When we now have all these medical codes that we have to write down. The government instituted this whole ICD-10, which now we have codes that say, basically I've said if we can get the right code on our sheet in the office, we don't have to dictate anything or say what it is, because it says that it was a right wrist sprain with a full moon when the weather was 27 degrees, and you get this long computer number, and it contains about everything. But contusions are things, bumps, bruises. Sprains are when a joint actually gets twisted in a ligament theoretically. So if you think of a contusion, that might be where you get whacked in a shin during softball. A sprain would be something where you roll an ankle or land on a wrist and there's some ligaments in a joint. Joint swells up, ligament gets sprained. Sprains come in 3 degrees. The one that hurts a little bit, the one that you can't really walk on, I'm talking about an ankle, and the one that you need to go see a doctor about. So that's 1, 2, and 3. What it really means is the third one is really unstable. A knee, if you can imagine a knee, guys get hit in football, they get hurt, they walk back out, that's a grade 1. A grade 2 is, well, we may be able to play in the next 2 weeks, and grade 3 is they're probably headed towards surgery. Fractures are the same as breaks in the world of language, and it all falls down to 2 categories of non-displaced or displaced. And so most non-displaced or minimally displaced fracture, if you're broken bone and it's just basically the same area, cast, sling, ACE-RAP. Displaced fractures, surgery. That means different zip code, and the further the zip code, the bigger the operation. Burns, electrical, fire, chemical burns actually end up being fairly common these days in work environments. And then musculoskeletal disease is this, arthritis on top of all these things. The cost increases, what I went through before, with each condition. And the most expensive, as they take all these comorbidities with blood pressures and diabetes and all that, is obesity and depression. You say, well, why is that? I don't have a reason. I read a whole bunch of papers, don't have a reason. What it means is that general health is probably pretty good for you. And when we get in medical definitions of obesity, I don't think we almost need a separate medical category where the weight would have an impact on how we treat people. So, and that means probably morbidly obese in a higher category. Depression, probably a depression that would be treated, not just low-level depression. So these are real medical terms. And so regardless of any injury type, that whole list I went through before, if you have other factors going on, your time off work is going to be much higher. Your colleagues' time off work that you have to work your vacation schedule around is going to be a lot different. So it's something that we have to be aware of. The workforce, and I don't know, do you have a breakdown of Hendersonville City? Is it more male than female, or is it?
Yes.
Is it? How, what's the number, do you think? 60-40 or 80 men to 20 women, or is it more? Wow. Okay. So if so in a lot of jobs, fire department, big numbers, men. Yeah. Oh man. Yeah. Yeah. 2 women. Yeah. So I mean that's a huge, when you start looking at an employment group, that's a huge thing to take into effect. But if a workforce is 50% men, 50% women, which the United States is in general, the comorbidity claims 65% men, 35% women. And that doesn't mean women are all thin and healthy, but they might be. I'm sure in this room they are. Men may be less healthy. Lots of times there's more physical work. And then the other part of this with the comorbidities, this is the word of the day, I guess, is that men, when they get injured, oftentimes end up at a hospital more because, and once you're at that hospital, I said everyone's recording everything about you. Doctor's office, not always, but the hospitals code everything. So they're going to run head to toe, and I look at any patient I have that goes in the hospital, I didn't even, I could talk to them for 20 minutes and didn't even know they had half the problems that get listed. And I think it has to do with billing and some other things. But the hospitals code everything. So if a man presents at the hospital, more likely, then they're going to have more medical problems listed. The other thing that I've heard is that men flat out don't go to the doctor as much. And one of my medical colleagues says that unless their wife makes them go or they can't get an erection, men are not going to a doctor. And that's funny, but I think based on TV commercials, that may be the case. So I just came up, case example, 56-year-old worker, construction worker, low back strain, 240 pounds, diabetes. Probably if 240 diabetes, you probably throw in a little high blood pressure, some other things, you can make a long list. If they just have back strain, an uncomplicated back strain is a 10-day event. That would be like a tweak of a back, you're up and going. If you throw in overweight, you can look at 26 days on average, and these are big studies nationally. And if you throw in depression on top of diabetes, you're looking at a 153-day episode, which is a 6-month episode. And you say, well, is that morbid obesity and medical depression that you might be in a hospital? It wasn't in that category. This is just, but this is on the job. This is not digging in your garden and you've got to suck it up and get to work. This is work-related injuries. So this is something that would have a huge impact on any employment group. It would have a huge impact on your family, on your livelihood. Big deal. What do we do about all this? Prevention, wellness programs. I'm not here to cure any diseases today. I think my profession, I guess we all want you to go out and break things. Not really, but that's what job security is for me. Frosty decks with old ladies that need to walk their dogs seems to be about this time of year. We have a little surprise frost in the morning. The dog runs out, and Matilda falls and breaks her wrist. That seems to be a good thing. But wellness programs have a 4-to-1 return on investment in healthcare savings, and very few. Do we have gym memberships through the city here in Hendersonville? Employees? Yeah, so they have a deal. Because if you can imagine the dollars that go in, now, the dollars that go in don't make someone go to the gym, but the dollars spent, it has a 4-to-1 return. You say, well, why wouldn't every corporation, every community have that? Well, a lot of them do. A lot of people don't take advantage of it, but it's really there, and it is a big, big deal. And that's why companies push wellness. That's why companies, employment groups, communities try to have people involved in their own health, because there is a big return. Don't think it's out of goodwill. You know, even as doctors, we all love you very much, but what we really want to do is see you healthy and keep you out of the office. When we identify conditions, everyone, you know, in our health insurance now, they have a whole tobacco section. That seems to be a hot topic and whether you're on tobacco or not, and they may even blood test for things with Blue Cross or Cigna. But we want, you know, if they identify the conditions, the whole idea is not to slap people on the wrist. The whole idea is to say, let's just identify, talk about it, see if we can do anything about it to help your general health. We can, you know, monitor utilization of some of the wellness things and monitor prescriptions, what people are taking in the long run to see what some of their problems are. And some of the other studies that we need to do as a community, and this is a little more medical. This slide, you know, probably doesn't necessarily apply here, but the people that are looking at this that work with insurance companies through Hendersonville Hospital are going to look at, you know, total claim costs, lost time, litigation rates, and the claims durations. But this affects really everyone in this room, because as we start living in a community, paying for employees, the only way we support all this stuff is through our tax dollars. So it really is a big deal. It affects everyone here. And when we say, does the presence of these conditions actually increase the risk for workplace injury, this gets to be, you say, well, are there factors getting in and out of trucks, getting in and out of your desk, things like that, that some of these problems could affect? Certainly health problems affect attendance. If people are in and out of the hospital seeing doctors, we now have paid time off, all those things, but it is really, really important. And I know that's running through fairly quickly, but I always like to leave time for pizza and questions. And I think I'm more than happy to answer any questions about this, but I think in general, I'm an orthopedic doctor, I'm in the community, and if anyone has questions about just things we're doing around here, I'm more than happy to answer. If you have other things, you can move on. But are there any questions at all? How was the pizza? Did you have a question? No. Okay, good.
I have a question.
Sure.
What exactly is arthritis?
Okay, that's a good question. Most of the time, there are two major kinds of arthritis. There's inflammatory arthritis, which would be the kind of rheumatoid arthritis that you see people with crooked fingers, and, you know, grandma had, you know, crippling arthritis. And then there's something called osteoarthritis, which we would really consider more wear and tear arthritis. Sometimes there's a combination, but what it really comes down to is all of our joints have these nice smooth surfaces at some point. And over time, they rub and wear, and then they kind of wear out. And if you have nice straight legs and you're lean and all these things, your joints don't wear out as much. And if you're bow-legged or knock-kneed or crash and burn a couple times, then the cartilage takes a hit. And cartilage, which is on the ends of the joints, doesn't restore itself as well as some other things in our bodies, and it just wears out. The other thing that will happen, some people are just sandbagged with poorer cartilage than others, and it blisters open. And arthritis is not something where the cushion goes from there to there instantly. It has to be, it's usually an up and down thing, and that's why people can be really, really sore for a while down here, and then they kind of get better, and you go through cycles. So most of the joint arthritis, if that helps. So it's when your cartilage, end of the road arthritis is where the cartilage gets down to bone on bone. And cartilage is the little cushion we have at the ends of our bones in the joints.
So what are good things to do to prevent it?
All the things, don't get hurt. My 20-year-old son, 20-year-old son, you know, just banged his finger that broke into the joint. So if you're going to get hurt, don't break into a joint. But so stay lean, stay healthy. Do any of the over-the-counter supplements make any difference at all? The answer is if they work, they're healthy, and there's nothing dangerous about them, but the chondroitin sulfates, those type of things are not FDA controlled. You aren't really sure what's even going in. But in general, when they put tracers on those, they have no bearing of getting to your joint at all. So they aren't going to build cartilage. So the things that help the most are staying relatively fit and avoiding big contact, and then it comes down to genetic issues as well. Yes?
What about like HA joint, like the collagen?
Yeah. Like I said, if it helps knock yourself out, it's all healthy stuff, but it doesn't, scientifically, it doesn't make a difference. There was a great book that came out, I think in 1997 or 1998, called The Arthritis Cure. It had to do with chondroitin sulfate, and the main part of that book was eat right, stay fit, take anti-inflammatories from time to time, and if all else fails, then try these things. And there's no harm done. Apparently, dogs are more active when they take it, when they have old joints. Joints get nutrition from movement. So even little old ladies in nursing homes that have horrible joints, if they can just get up and move a little more, it actually helps their joints. So the supplements, probably not so much, but again, nothing dangerous. It's a multi-billion-dollar business. Motrin probably works. And women get to take calcium. Keep your bones strong. And even that they question these days. So.
Anybody else have any questions?
Right. And yes, I didn't even know if anyone would come in. It was so nice outside. I got out of surgery. I thought, oh my gosh, another day in December. I guess it may come crashing to an end soon, but it's pretty nice. Thank you for having me today. Did everyone get? Yeah, did everyone get something?